Okay, so I'm gonna do a mandibular block on my awesome patient over here who had her third molars extracted, and she's still having some pain, so she wants to get some numbing done down there, and that's a perfect opportunity for us to show you my technique. Now, I did wanted to show you before we get started that I am gonna be using Marcaine. Normally, I would not be using Marcaine. She just wants to be numb for an extended amount of time, so usually this will be lidocaine. I'll use one lidocaine and one articaine. That's my typical mandibular block that I use. I'll start with a 2% lidocaine and go with a 4% articaine, followed by that. I pretty much do that on all patients, no matter what I'm doing. That's my kind of go-to standard, and I have very good success with that. So just wanted you to know if you see the mepivacaine that I don't usually do that. We're going to be using lidocaine usually.
Okay, so I got my finger now on the coronoid notch, which is the corner of the mandible on the bone. I'm going to find the pterygomandibular fold right through here, and the pterygomandibular raphe. We're going to go just above that, right in that triangle, and we're going to be a bit high. And I'm coming all the way, if you notice my syringe against the other side of the lip, coming at a very steep angle. We're going to come in and I'm going to feel the bone right there. Now I'm going to just creep along the edge of that bone. This is kind of difficult because I'm in a camera, but beautiful. Okay. Now we're going to deliver. Beautiful. Okay, guys, so let's sum this up real quick. What I use for my mandibular block technique and what's been really successful for me. I know you'll put your own spin on it and do the things that work for you, but this is what has worked for me. And I can tell you I very rarely miss on these blocks anymore. It's been a while. But first off, remember, I always go with one lidocaine, one 2% lidocaine, and one 4% articaine. I use that same pattern for pretty much every single patient I do, unless it's a pediatric patient. And then on a pediatric patient, it just depends on their size. Sometimes I'll use just one articaine, sometimes I'll use just one lidocaine. But I really want to encourage you, don't be afraid to use articaine on a block. It's very effective. I never go with two articaines at once, though. I've had complications with that, with some temporary paresthesia or paresthesia that was just hung around for way too long. But I never get that. I don't think I've ever had that issue when using one lidocaine and one articaine, and I almost always use two unless it's a pediatric patient. Always palpate the coronoid notch, so always get your finger on the coronoid notch, always feel that, and then always go high. You can set the patient up, and gravity is going to take the anesthetic down to the nerve, so I always would rather be too high than too low. And then always start wide. I always put the syringe all the way almost to the commissure of the other side of the lip. That way that I can go ahead and bump bone, because that's the most important thing, is I always bump bone. I always have to feel bone. If I don't, usually I'll back it out and go in at even a wider angle, or go until I find the bone, until I can actually bump bone, because if I don't, then I can't be sure. I don't know if they're going to get numb or not, which I don't like. So I make sure to always bump bone, and to do that, it's very easy to do if you go wide, bump, and then just creep along the edge of that. Now you want to be gentle, obviously, but that's kind of my technique's been very effective for me, and I hope this gives you at least some ideas and can help you along the way. All right, thanks, guys.